Hi everyone, Dr. Hall here, and we're going to do the superficial muscles of the back today. So I'm starting with my skeleton, and I'm going to actually start with some deeper muscles, not the deepest. There are many layers of muscles in the back, but I'm going to start with some deeper muscles that are up in the neck. So one of the things to keep in mind when we're doing the back is that many of the muscles are named for their shape. So this first set of muscles that I'm going to show you has this diagonal shape, attaches from the spinous processes on the cervical spine up onto the occiput here, the occipital bone, and has this kind of chevron shape to it. There's another muscle that has also that same chevron shape that's just inferior to that. And so these two muscles are called the splenius muscles. Splenius comes from the word that means bandage. I don't know why a chevron shape is a bandage, but this one, which attaches to the head, is splenius capitis. And this one, which attaches superior laterally to the transverse processes of the cervical spine, is the splenius cervicis. So splenius capitis, splenius cervicis. The other deeper muscles that I want to show you are the Levator Scapulae. So I like these because they're named for what they do. They're going to elevate the scapula. So they also attach to the transverse processes of the cervical vertebrae. Let me turn it this way actually. And then they insert on that superior angle of the scapula. So right on the superior angle. And so their name tells you what they do. Levator Scapulae, like an elevator, right? They elevate the scapula. So when you shrug your shoulders, you are using your levator scapula. You're also using some other muscles, which we'll get into later today. So the next set of muscles I want to show you, which are on your term list, are medial to the scapula, and they're named for their shape. And they're kind of, this one's skinny, so it's a little bit more difficult to appreciate, but kind of a rhombus shape. So a rhombus is a quadrangle, like a square, but it's been tipped, right? It's been tilted on each side. And so first we have the rhomboid minor. Oh, I made it a little bit too long, which attaches to the medial border of the scapula and then to the spinous processes of the vertebrae here. And the rhomboid minor is easy to keep track of because it inserts on the scapula, on the medial border of the scapula, at and superior to the spine of the scapula. So this is the rhomboid minor. Inferior to that, again another rhombus, we have the rhomboid major. Now in real life, these muscles can sometimes be hard to distinguish from each other. There's not always a very clear separation. So just always remember that the minor is at the level of the spine of the scapula or superior in its attachment to the medial border, whereas the rhomboid major, which is the larger of the two, attaches inferiorly to the spine of the scapula. And so fiber direction for all these muscles is this way. Well, that's not working. Let's try this. Right, so fiber direction goes this way for all of these muscles. Pretty neat. So the next muscle I'm going to introduce you to is the Latissimus Dorsi. So this muscle is named for its shape and location. Latissimus comes from the Latin. So latitude means width. Means how wide is something. And in Latin, if you put issimus on the end of something, it means the mostest, right? So we might have wide, wider, widest. The Latin language has, well, I don't know what wide and wider are, but widest is latissimus, right? So this muscle attaches broadly to the spine, kind of just hits the inferior angle of the scapula, and then travels out to insert on the anterior humerus. So that's really important. It doesn't attach right here posteriorly. It attaches on the anterior surface of the humerus. So I'm going to go ahead and put my other one in place. this big triangular broad muscle. This is that muscle that gives people that kind of V shape, bodybuilders, gives their trunk that V shape. And as you can see, if this muscle shortens, it pulls the humerus back this way. That is extension of the shoulder. If you're, oh, this doesn't move in the normal ways. If your arms are out, right, if they're abducted, it will also assist with adduction. So think about lat pulls in the gym, and now you can understand what's happening. The next muscle is going to be the most superficial of all of these, again named for its shape, the trapezius. It's a trapezoid or a diamond-shaped muscle, and it's going to attach very high up and out to the sides. So the superior portion of the trapezius attaches along the cervical spine via a ligament to the occiput and down this way. So that's going to be an extensor of the spine if it's activated on both sides. If you just use one side or the other, you can pull the head this way or pull the head that way a little bit. It also, with its middle part here, which comes out and attaches to the spine of the scapula, it can elevate the scapula. So again, just like the levator scapula, that can help shrug your shoulders. And then we have the inferior portion of the trapezius, which then can depress or pull down the scapula and also kind of pull them in. So we're almost finished. One last muscle that I want to show to you is the deltoid muscle. Now the deltoid muscle is also named for its shape because if you remove it, it's a triangle. So Greek letter delta, a triangle, think of like that shape that a river makes when it comes out to the ocean, that delta shape, that triangular shape. And so it attaches to the lateral aspect of the spine of the scapula and then curls all the way around, and it's going to come anteriorly and attach along the clavicle and then down on the humerus. So this is the major abductor of the arm, but it can also, the posterior portion can extend and the anterior portion can flex the shoulder joint. Let me put my other deltoid muscle in place. That one's bigger. Been working out. Okay. The last thing I want to show you is the nerve for this region, which is the spinal accessory nerve or cranial nerve 11. And you might remember, hey, we learned about that one up in the neck, and we sure did. So you might recall that that muscle came out. Let's see, I'm going to make my sternocleidomastoid muscle here if I can. And so you might recall that this muscle comes out underneath on the deep surface of the sternocleidomastoid muscle, and then it dives underneath, let's see if that works, the trapezius muscle. So it's its main purpose, that's not going to stick right now, that main purpose of this nerve is to innervate the trapezius muscle. It's falling apart. All right, but so it's going to be running along the deep surface of the trapezius muscle, will be the spinal accessory nerve. So let's go ahead and dissect out and review. We have our trapezius or diamond-shaped muscle with the superior, middle, and inferior portions attaching to the spine of the scapula here, down on the spine, up on the neck. We have our Latissimus Dorsi muscle with a very broad attachment on the back, right? It's the widest muscle of the back. Latissimus Dorsi comes out and inserts on the anterior humerus. Our deltoid muscles here, touching along the spine of the scapula, around the acromion, and to the clavicles. Rhomboid major, oh, there's my spinal accessory nerves that were deep to the trapezius. Rhomboid major, rhomboid minor, levator scapulae, and splenius cervicis and splenius capitis. So that's it for the muscles of the back for today.